Hi, I'm Dr. Jeff Borenstein, editor of Psychiatric News, and I'm here with Dr. Maria Oquendo. Dr. Oquendo is the incoming president-elect of APA. Maria, thank you for joining us.
Thank you.
And you're beginning your tenure, and I want to ask you to speak about an issue that I know is very important to you, which is prevention.
Yes. So I think one of the most exciting things that we're starting to work on as psychiatrists, as a field, is trying to prevent the development of disorders before they blossom into the whole entire spectrum of what we can see when patients are struggling with major psychotic disorders, major mood disorders, and trying to intervene early so that we can identify youngsters, young adults, before they get too far along in their illness, and intervene to also help them process and go through the maturation time and develop the kinds of abilities and skills and coping strategies that they need to be able to do well in life.
To delay, avoid, even postpone the onset of symptoms,
Exactly.
Minimize the effect of those symptoms makes a big difference in the life of a youngster.
Absolutely. And I think that we have opportunities now to do that. Certainly in the last decade, we've learned a lot about early psychosis and intervening early for individuals who look like they're headed towards schizophrenia. In bipolar disorder also, we're getting much better at identifying youngsters who look like they have depression and anxiety and agitation, but in fact, what they have is a bipolar disorder that's just starting to blossom. So those are some examples of the kinds of conditions where we can now identify people earlier and hopefully make a difference in terms of the development of symptoms.
I know one of your passions is reaching out to the public and educating the public.
Yes, absolutely. So I think that one of the things that I would very much like to see in the APA is a further strengthening, because the APA does a lot of outreach to the public, but do a further strengthening of the APA's message, especially around research. So one of the things that I think the public understands is that for really severe conditions like autism, like schizophrenia, like cancer, that research is really important. But even for conditions that the public might not think of as being that serious, even though, of course, the person who has, for example, an anxiety disorder suffers a lot, to the public in general, if they don't know someone who has it, they might think that's not such a big deal, in part because it's part of the spectrum of normal experiences.
Everybody has some degree of anxiety.
Absolutely. And so for the public, it might be hard for them to understand that things like depression, anxiety, these conditions which fall along a spectrum of the normal human experience also can benefit from research, and that we can make people's lives much better if we focus on research and try to attack these problems, building the knowledge base for prevention and also for treatments.
I know you also want to expand our reach and involvement with Latin America and sort of bring APA beyond where it's been. I want to ask you about that.
I, for very obvious reasons, have very close ties to Latin America, and I think it would be really helpful in terms of expanding our reach. We, I think, reach a lot of people here in the United States, but expanding our reach and expanding relationships also with psychiatrists in countries where maybe there aren't so many psychiatrists. In some places, they're not as blessed as we are with, and God knows we need more psychiatrists as well, but they are even less able to provide health care. And so I think that establishing relationships with some of the South American organizations, the psychiatric APAs, can be a very helpful way to start collaborating with them and to try to think together about how we might serve people not only in developing countries, but of course in our country too. There are certain parts of the country where there simply aren't enough psychiatrists, and we might learn from them as well about how to work in those kinds of situations.
Well, you're going to have a very busy couple of years in front of you, and I think the APA, our profession, and most importantly, our patients are going to benefit from your leadership. And I want to thank you for what you have done up till now and what you're going to be doing in the future.
Thank you so much, Jeff. It's a pleasure talking to you.
Good. Thanks for joining us.
Thank you.